If anybody has a desire for coffee or water or anything, got 20 seconds to go. I'll go ahead and just kind of get us started here. If you want something, please help yourself. Glad folks can make it today. I think folks should have had the opportunity to get an agenda if they were in their office late this afternoon, the minutes rather. And you have in front of you an agenda for the day that we have pieced together based on our meeting last time and discussion since that time. I'll take a couple of minutes to go over that with folks and then give people an opportunity to adjust our thinking and schedule if that proves to be needed. We wanted to spend a few minutes with everybody. This is our fourth meeting as a partnership, and I wanted to take a few minutes and go through the timeline to completion. We did make some adjustments. Hey, welcome. Grab a coffee or a bit of water. We did make some adjustments in our July 24 meeting, and so we've got a slightly altered timeline for completion. I'll spend a few minutes going through that and making some remarks on the overall process. If you may recall, last time, July 24th, we did give ourselves a collective assignment at the end of that meeting. There was an interest in sending out an inquiry to determine which of the perceived needs in our listing. I think that listing was about 70, is that right, on the perceived 69 or something like that? Don't quote me on the numbers. But we were trying to discern how many of those perceived needs met the threshold of having two supporters in the partnership. A number of you responded to that inquiry, and Josh has compiled the results of that exercise, which I think do give us structure that is not 100% processed, but rather starts to list actual health needs that appear to have some level of concern within this group. Josh will spend some time going over that with you all and enabling some input on that process. We also talked on the 24th about the idea that individual partnership members may want to make a case for particular needs to the rest of the partnership. And we do have that opportunity available today if anybody wants to take advantage of it. I will say we did put out a query earlier asking if anybody did want to make those testimonials. If I'm not mistaken, we didn't hear back from anybody on that. So I'm going to stop for a second and ask, has anybody formed the view that they want to make a very short case for any of the needs that have been determined to have support?
I had sent something to Josh just to add to mine.
Okay.
So I updated the list and I included that in the little
Okay.
summary.
Okay.
Joel will set aside a minute or two if you want to expand on that. And anybody else know right now that they want to? I will check in at that point on the agenda. That possibility is there and available to everybody here in the room. If people want to produce a little paragraph or something of that kind to make a case for a particular need, that is also a possibility that is open. Our hope today, though, is to get pretty close to completed with the list of data-driven needs, which has already been determined. Was it set in place by the good work done by the subgroup on the data issues that met in July. And now we have a universe of an additional 29 or 30 perceived needs that have the support of at least two partner members based on the feedback we've got. And so those needs are in place as well. Our hope is to get that list pretty well finalized and then be able to go out and do the query of the members of the partnership that we had talked about last time and using a survey mechanism. We thought we would close the meeting today talking about the construction of that survey, what it might look like. Dr. Baird, there she is. Dr. Baird put together a couple of sample questions for us, and so we'll share those with you as models. Our hope is to walk out of here able to construct that survey mechanism and to have a pretty good handle on the needs that are going to go in that, essentially. So that's what we had devised for our next hour and 53 minutes or so. I'm going to stop for a moment and see if people are comfortable with that agenda, have additions, subtractions, or concerns regarding what we're going to do today. A lot of quiet, which I think I'm going to interpret as enthusiastic support.
Let it be so in the minutes.
I'm sorry?
Let it be so in the minutes.
That's right, you got it, you got it. Speaking of the minutes, did we pass those out yet, Josh, or not? So you have minutes in front of you. We had quite an active meeting on the 24th. I think, Jeff, you said you watched the video,
Yeah.
right? So it was so exciting, it drew you in for an hour and a half. We had quite a meeting last time. We have attempted to summarize that meeting in the minutes. I have to say, this one took a little more effort than your typical meeting minutes, so do take a few minutes to give it a look, see if we've captured what's important about that meeting. We made an effort to do that. I will just interject about one point of potential confusion. We have two versions of the framework in that document that may confuse you out the gate. The first version embedded in the minutes is the version that was dated July 10th. It came out of our July 10th meeting. We made a couple of small adjustments at the July 24th meeting, and the result is the version that is appended at the end as an attachment. So that's why you've got two copies of what look like the same thing. So I'll just stop, and I'm going to let people take a few minutes, 3 or 4, to read through so you can kind of catch yourselves up on where things were. And if you do see things that need to be adjusted, let us know. Some still reading and a few lifting up. I'll wait 60, 120 seconds, and then we'll open it up for discussion. Count for We've got just about everybody looking up and feeling comfortable, or at least looking like that. Any comments, questions on the minutes? Does that look like some of the high points of our discussion on the 24th? I see a nod or two. I see several nods. That's very good. Anybody want to make a motion to approve the minutes?
I'll second.
We got a motion and a second. Any objection? Okay, the minutes are approved. Let me, I think we pass out a timeline here.
Take care of that.
Just by way of context, in our meeting on the 24th, there was a pretty wide-ranging discussion, but there was, at that time, the introduction and discussion of some ideas that emerged from the work group on data quality around ways in which this group could not only identify a list of needs that they thought were reasonably well substantiated, but that they might also register some prioritization of which needs this group felt as a whole were most pressing, in a sense, or most important. And toward that end, the idea emerged that we might use a survey mechanism within the group to essentially seek to quantify the views people had based on the evidence that we've been able to get our arms around. As a result of that, we did talk with the group and agreed that that would require a bit of change in the timeline for completion of the group's work. And so what you have in front of you now is our effort to revise the timeline to reflect that. And I'll just say very briefly, we held a meeting on the 19th. That was our kickoff meeting just over 2 months ago. We held 2 meetings in July, the most recent one on the 24th, and that led us to the point where we have a framework that I think most people concurred with at that time. The meeting we're at now is our 4th meeting, and we're envisioning walking out of this meeting with a pretty well solidified set of health needs that have been reviewed with respect to the data supporting them, that have been reviewed with respect to the level of support that this group had for a range of perceived needs, and the result we're going to share with you here. We did send the results out previously as well, if I'm recalling correctly. So most of you, and most of you probably have had a chance to look at that document. But that's where we stand right now. What we envision happening after this meeting is essentially we'll have from you all our walking orders to construct a survey instrument that will go out to all of you with a set of questions to allow you all to register your level of concern as an expert panel that have been called upon to render your judgments on a set of needs that were identified by 3 previously conducted needs assessments. And our hope is to conduct that survey, convince all of you all and your colleagues who are not here to the extent we possibly can to respond to that survey. The end result will be a compilation of responses that will be quantifiable that we can then present to you at our next meeting. Right now, we envision that next meeting taking place at the end of September or the first couple of weeks of October, allowing the time for the survey construction, implementation, and data compilation. I can share with you that there's been a fair amount of work internally already in starting to draft pieces of a report based on the processes that this group has undergone. I would envision we'd have a discussion at that meeting about the report, how that relates to the quantified results that we get out of the survey, and what that report would look like. Right now, our internal thinking, at least, is that that may be this group's last meeting. We would compile that report, we would send it out for your all's review and comment, and then seek to finalize it before making it publicly available. There would be some opportunity for public comment, at which point it would be solidified. And we would envision that process unfolding during the months of the fall. But right now, in terms of meetings, according to our current thinking, at 6 o'clock today, we'll be 80% done with our meetings, essentially. If people want to have a final meeting, we're open to that. But we feel that if we get the data and the findings in front of you and seek your input on the report, and then get it in front of you by email, giving you all an opportunity to steer us, that would put us in a position to finalize a report this fall. At the same time, and this is something we've had discussions with the health commissioners about, there's going to be a process whereby a community health improvement planning group would be developed and identified, and that process would yield a similar work group that would take the information you all are providing and start to develop targets, timetables, and measurable objectives for the county in terms of improving upon some of the health conditions, health situations, health needs that we have available as a county. And that process, we haven't finalized the timetable, nor have we talked to Jeff or Chip or Kelly or anybody about it, but the preliminary back of the envelope calculations I've started to think through is that could take probably over a period of up to a year, or at least 9 months to work through that process, at which point, according to FAB, the health departments would then have to, or be required to develop strategies prior to that process unfolding. I will make a contextual comment here, and that is that this process, at least as I understand it, isn't intended to declare 1, 2, 3, or 4 needs as the needs that are important to health in Portage County to the exclusion of everything else. This process is far more oriented towards setting up a process of communication, information exchange, and progressive prioritization over time. So I make this comment because I hope and feel confident that the most productive use of this group's efforts is to recognize that we can only target certain things at certain times, but that doesn't mean that we're never going to do something else. In order for the health departments, at least, to maintain their accreditation, they have to go through this process every 2 or 3 years. And just because there's just because there is a set of needs established at one time and a set of strategies put in place doesn't mean that all of a sudden everybody in this room puts their head in the sand and ignores any need that may develop over time, or that may rise in the priority list over time. So I think it's important for all of us to keep in mind that this is that we're really unfolding a process here that can enable collaboration over an extended period of time, rather than essentially determining one set of needs are more important than others for time immemorial. So I offer that little editorial just because I've been reading the FAB stuff, and the FAB stuff is rather clear that that's the kind of process they envision. And given that, and given, I think, the interest of the health departments in moving forward consistent with that process, what we've got here is a process that can enable, if it's managed and participated in, this group to be productive for a long time in a lot of different ways. Okay, I'm going to stop and be quiet for a moment and just ask people to have questions or reactions on the timeline. We did not set a date right now for that last meeting in late September, early October. I would like to kind of get an idea of 1 or 2 dates that would be good for this group, but I'm gonna be quiet first before I ask for that. You mentioned it now, so you can take it.
I can relate to myself. I can't tell you what dates are good, I can tell you what dates are bad.
Okay.
And the dates that are bad on me are the 6th and the 7th of September and the 19th and the 20th.
19th and 20th of September, how about early October, Dan?
That would be okay.
I'm sorry?
That's okay.
That's okay. Anybody have, yeah, go ahead.
I'm going last week of September and then the 2nd of October.
Okay. Other people have dates they absolutely cannot do? What if we, given Sue's gone the end of September, what if we said the week of, what is this, 6th or 7th of October? Have a target that we will communicate with you further about? You have that in front of you, Josh?
Yes, the 6th to the 10th.
The 6th, yeah, between the 6th and the 10th. Why don't we target that week for right now of October? And I would say, what is today? Today's a Thursday. The Thursday, the 9th? Why don't we?
Bob and I would be.
Okay, I'm sorry.
Our finance committee will be meeting on the 9th of October.
Yeah, I would say it's the 2nd. So October's.
Yeah, Thursday would be bad.
Would be bad for you for a couple of, what if we tried 8th?
Is it Wednesday?
Yeah, Wednesday, the 8th? Well, we will set aside the 8th, maybe the 7th and the 8th as target dates. And then what we would intend to do, I think, is to send a note, and if there's a need for adjustment, we would communicate with you at that time.
You said the
7th or the 8th are the two targets. And I'm thinking late afternoon, 3 or 4 o'clock.
Do you really want everybody to say that? I mean, I can't come on a Tuesday, but that doesn't mean you shouldn't have a meeting on the Tuesday.
No, I'm trying to get a couple of dates where we think most people can be here.
Yeah.
7's not good for me. 8 is fine.
All right.
Then why don't we say the target is the 8th? I hear no objections to the 8th for the moment, so let's,
Is that a Wednesday?
that's a Wednesday.
That's unusual.
Do you need me?
We always like to have you.
I teach until 5 on Mondays and Wednesdays.
Okay. Why don't we say,
Maybe we could.
What happened to Thursday?
These two of them.
They couldn't,
aren't
okay, that was that
available.
Thursday or every Thursday?
why don't we tentatively say late afternoon on the 8th, somewhere between 4 and 5:30? Does that sound, 5 too late for people to start a meeting at this
You
time?
can just do it at 4 and I'll just come when I'm
Somebody can-
done.
Yeah, 4 o'clock, the 8th.
What
That's our
about early?
tentative date.
Is the 16th too late? So we can catch Heather? I hate for her to miss this meeting. I know
She's on the edge of her chair waiting for it already, I can tell. Okay, well, that would be a follow-up date as well, the 16th. What day of the week was that? Jen?
Thursday.
That's a Thursday, I'm assuming if the 9th was,
It is, I got it.
Okay, the 8th and the 16th are our two targets, and we'll communicate with you in the second half of September.
So we can do 4 o'clock time frame.
Yeah, 4 o'clock. Now, let me stop and ask, does this timeline make sense to you all? Is there concern, is there question? Make sense to you, Dan?
Yeah.
Good. Others have? Dan is enthusiastic. Good for him.
I'm just as enthusiastic as you.
Good, good. Thank you, Sue. Thank you.
I think we've all had a rough day. We're trying to work through it the best we can.
That's right. I'm trying to find enthusiasm wherever I can find it.
This is my 4th meeting today, so now you know why I'm
Fair enough.
pretty wore out.
Chip?
I would just hope we don't extend it again, because we have to move into our chip process if we're gonna get this thing done in a couple of years. To our accreditation.
And I'd be open to exploring times even a little before the 8th and 16th if they do end up working for people. So. Okay, we've got 2 dates set aside. Any other discussion on kind of evolution from here? The other thing I'll just mention to you, Chip, there's a fair amount of this report that can be completed without the findings in it. So the date of this meeting will feed the report, and the report could probably progress regardless of the time. Okay. I'm going to turn the agenda over to Josh, and he's going to take you through our homework assignment from the 24th and the responses we got to that and what that means.
So we did a little exercise in between the last meeting and this meeting. We sent out the list of 81 health needs to you all, and we asked simply for folks to answer yes or no, you support that need.
Everyone's so excited.
Yeah, everyone's just
Paper with colors.
Right.
Everyone has
Now, I do have a pair of reading glasses for folks, if anybody.
Fine glasses.
Not that the group's over 40 or anything.
Yeah. Nishikant,
Josh
can
and
you, Nishikant, can you read this?
Try to put it on a postage stamp.
So anyway, we did a little exercise, sent out that list of 81 health needs, asked you all to answer yes or no for each need, whether or not you felt that need was important for Portage County. And we also asked you all to provide any additional evidence you may have to provide for any of these needs. So the idea of the exercise was to start to see which of the perceived needs that we've identified meet the perceived needs criteria that we all agreed on. And so this document, in kind of small print, I'll admit, attempts to present the results of that little exercise. You'll see that it's color-coded. It's separated into 3 different categories. The first category is the data-supported health needs that we discussed at the last meeting. These are the needs that meet the data quality work group standards for good data.
And do not beat the health goal.
So there's 2 parts to the standard. The data itself had to score above 7 on the data work group's scoring formula. And there also had to be a Healthy People 2020 target that showed Portage County's performance to be worse than the target, right? And so these 12 needs meet that standard. In the second group, these are perceived health needs, and there's about 40 of those, and these are the health needs that, when we got our responses back, that indicated that 2 people supported these health needs on the list. And the final group is the perceived health needs that do not currently have support from at least 2 members of the partnership. So basically, if we were to prioritize right now, we would be prioritizing the needs in the first and second group, but these 29 needs at the end would not be included in the prioritization process. And so as you all look these over, we would welcome any additional evidence or corrections to our little evidence summaries that we have in the final column. These summaries are going to be used by you all as a sort of cheat sheet when you fill out the prioritization survey. So if any changes or additional evidence we've provided in these summaries, or if folks feel that any of these 29 currently unsupported needs should be moved up to the supported category and should be considered in the prioritization process, please let me know. We can either do that now, or we can do that by email after you've had time to review this. We just ask that any changes come to me by the end of the day tomorrow.
I'll just interject. I think we had limited participation in producing this list. I think we had 6 responses that produced these 40 supported needs, which suggests that there was a fair amount of agreement among the 6 who responded. But to the extent that 6 is different than the universe of 21 people on this group, you know, there may be some things in the unsupported category that that some of you feel should be supported.
Question of process. The very beginning of this, we submitted items that we felt were health needs. Were those considered in these 40, or were only those 6 responses considered?
No, those were included in the 81, the list of
Okay,
81.
so there were feedback from the beginning from the entire group, plus the 6 responses from the homework exercise.
They fed the mushroom cloud of large numbers of needs that we talked about last time. What we're talking about now is the funnel through which that mushroom
Right.
was stuffed.
The only question, and this is just because this is dear to my heart from my work that I did at the health department, but is the immunization evidence section. It talks about that there's not a corresponding healthy people target. And
Separated out for every single antigen or combination.
well, but there are ones that I looked at that I saw when I looked it up that talks about, adequate coverage levels for children under the age of 36 months. So
But
that's
it's not directly relatable to what was measured in the assessment.
of what data that we currently have. Because ours was a coverage level for children under 36 months for the 433 series, is that?
Right, it was a different, theirs was by 35 months, yours was by 24 months. I think that was the reason.
So I understand that it's not exactly, but it's still a goal that Healthy People has, so.
I think we could
And
include
that's what
that
I'm
as,
confused by.
in this evidence summary.
Yeah.
I think this immunization was originally a health need that was identified as a perceived need in the previous assessment, so it didn't actually have a data indicator, like a measure with it.
Right.
So it's going to be in this perceived list no matter what.
Right.
But that is the kind of evidence we'd want to provide in here.
Right, because we have data from the health department that says that our children are 70% immunized by the time they're 36 months of age, so by the time they're 3. The CDC standard is that they should be 90% immunized by the time they're 3. So that to me says that we're not meeting, and that has improved because we have been measuring it for the last 5 years. So we know that it's gone from 65% to 70% in 10 years. So that, to me, shows there is progress. Would we want to keep that information on this so that it could be one of those things that we want to additionally fund if it raises to the
I'm
level
gonna
of priority?
Use your comment, Kelly, as an example.
Mhm.
If that information, quite frankly, that information sounds quite relevant. I gather, Josh, it's not in our evidence right now.
No, it is not.
So the point I would make to you on this, Kelly, is give us the language to support that. It will go in the evidence, and that's exactly what we hope to hear from any of you as you look at this evidence and realize that maybe there's some pieces here that people should be aware of. Part of the objective of this overall process from step 1 is creating a shared understanding regarding what the evidence is and where we are. And your comment, Kelly, is exactly on target to doing exactly that. And I would just use that as an example of the kind of thing we hope you all will do so that this becomes a base of evidence that can be carried over time.